All right.
Oh, well, it works. You're good.
It's working
It's
now.
all yours. Yeah.
All right. Sorry for the drama there. Good morning, everyone, and thank you for that kind introduction. It's really wonderful to be here with all of you today. I was just in Whitehorse, but I had to leave because now I'm en route to Toronto. So this morning I'm joining you from Kelowna, BC, which is on the traditional territory of the Okanagan Syilx people. But I had the opportunity last week to spend some time in the beautiful cultural center there where all of you are today. And it was wonderful to be back and just reflecting on the incredible place the Yukon is and the incredible leadership from the 14 First Nations that ground us in the territory. So I'm going to reflect this morning on a few things just to sort of, I think, give us some context of where we are in the healthcare system and why the work of SPOR is going to be so critical in terms of moving things forward and changing the status quo of where we find ourselves with healthcare. So I think all of us know right now that there are many big challenges facing our healthcare system. One of the biggest challenges for sure is access to care. And we know this is an issue in the Yukon. We have thousands of Yukoners who don't have access to a regular care provider. This is an issue across Canada with 1 in 5 Canadians not having regular healthcare or primary care team. We're facing an aging population, which is another big challenge as we don't have facilities to allow elders to age in place or in their communities. And this again is another challenge that we face in the Yukon. We have a lack of workforce mobility. You have to be licensed individually in provinces and territories as healthcare professionals across Canada. And that really limits the ability for healthcare providers to be able to move to different parts of the country to provide care. And in a place like the Yukon, we've seen that with some of our families that need specialized services from BC or Alberta and haven't been able to have their team members reach out to them virtually into our territory because of the issues with licensure. So again, bureaucratic issues that are really impacting people's access. We have a poor data infrastructure, which means we don't really track what we're doing or the outcomes that we're getting or leverage what's working in different places. So that's hugely challenging. And on the background of all this, we have a health workforce crisis where rates of burnout are higher than they've ever been. And because of that, we're seeing a lot of people choosing to leave healthcare, which is very concerning because of course you can't create a new healthcare professional overnight. And all of this is in the background of the federal, provincial, and territorial government sort of playing political hot potato with healthcare. And we saw that yesterday at the conclusion of the FTP health ministers meeting, where there really was no agreement about how to move forward to deal with the healthcare crisis facing Canada. And I personally found that very disappointing, as I think we're all aligned about what the issues are, but we're just not seeing the political will to actually move forward in a spirit of collaboration instead of competition, which is really where we've been. One of the biggest challenges in our healthcare system, I think, is really a lack of accountability and a lack of being outcomes oriented. And I think a lot of this also stems from a lack of being patient partnered. And that's why I believe patient oriented research is going to be so important. The healthcare system should be designed to serve the people that want to use it. But it's very challenging to have that be a reality if you're not actually connecting with people around what their experiences are in the healthcare system, what their vision is for their own health and wellness, and the types of services they need to seek and to obtain those objectives. So I think the importance of SPOR is really, really critical right now. When we think about what's happening right now in the Yukon, many of the things I talked about, well, all of them really apply to us, but we have some very significant additional challenges. We know that we're facing a substance use health crisis that's the highest in the entire country. We know this is disproportionately impacting people in the communities. We also know that we need to decolonize our healthcare system and create spaces for First Nations views, lived experience, and leadership. And we've seen so much incredible leadership from the various First Nations across the Yukon during the pandemic, but also just in terms of drawing down services in education and in the healthcare sector as well. We need more representation in our healthcare professionals. You know, when you look at whose physicians are in the Yukon, we don't have any First Nations, Yukon First Nations physicians in our health workforce. And I think that's really concerning, and that needs to change. We also lack culturally relevant mental health services that can allow families to be treated as a unit. Again, we're seeing some things start to evolve in this area, but right now they're really inadequate. So I think these are some of the additional things that we need to be really thinking about for the Yukon. So in my view, I think the SPOR unit is going to be critical because it's going to provide an opportunity to bring the experience of Northerners into the health literature, voices that are often excluded and stories that are often not heard. There's so much knowledge and wisdom that can be shared and so much wealth of ideas about how we can move forward in a different way to create better health and wellness for citizens. And I also think as we work towards implementing the recommendations from the Truth and Reconciliation Commission around the healthcare system, we know that that's not going to happen if we do not have First Nations leadership and representation in the system itself. Both the voices of people's experiences, but also creating the opportunity for First Nations youth to see themselves as healthcare professionals. I think the SPOR unit can bring some of those opportunities to communities and individuals to engage in health research, which may spark that interest in more youth and get people thinking about healthcare and a career in healthcare and what that could look like. And that, I think, could be the beginning of really changing the future in our communities. I also think we need a commitment to the First Nations lens on what is knowledge. We know right now in science, a lot of our perspective is rooted in colonial views. We have really struggled, I think, to embrace two-eyed seeing in the way we look at health and even just knowledge and information. And we know that incorporating First Nations ways of knowing and knowledge can benefit all Yukoners and healthcare professionals as well, as we're able to unlearn some of the things we've learned and gain new perspectives on health and healthcare, and hopefully through that, better serve all of our patients. In the Yukon, I think where health research hasn't really existed at scale before, we have this incredible opportunity to make sure Yukoners see themselves represented in healthcare research and also see the importance of their experiences and stories in moving this field forward. I think this work will help improve health outcomes of people living in the Yukon, because you can't change what you can't measure, and you can't find solutions to problems that haven't clearly been defined. Understanding the problem means you need the right information and the right data. And I think the SPOR is going to give us that opportunity. And of particular importance, it's going to generate that information from the lens of patients and people with lived experience, which again, just gives us a whole different perspective. I'm also optimistic that there's going to be an opportunity for engagement and feedback in real time to evolve priorities and advocate for patient-oriented research to develop in the territory. I think this is the spark that's really going to set off a whole host of opportunities. And again, getting back to the idea of having more people in the healthcare professions in the territory, I think one of the positives of the pandemic is we've really learned the power of virtual tools. And I think now that we have Yukon University, now that we have the SPOR, I could really see down the road the opportunity for collaborations with other universities and learning institutions to partner with our institutions in the Yukon to create hybrid learning opportunities so that more Yukoners can train in these professions without necessarily having to face the idea of leaving their homes or the communities for years and years in order to become a healthcare professional. So I think once we start to build that capacity in our own communities, we're really going to see an opportunity for more things to build from there. I know all of you are headed into an exciting next few days, and I hope that in your time together, you can reflect on some of these issues, some of the things that are facing our healthcare system, some of the challenges. I think it'd be really wonderful to hear from all of you some of your ideas and solutions that we can then bring forward. I think, right now we're really at a critical time where our advocacy to government and leaders is so important. In the Yukon, I think we're at a real opportunity in terms of the healthcare system. We have putting people first, which is calling on our government to really revolutionize our healthcare system and take a different perspective. We're also looking at the creation of a health authority. These are huge changes that are really, I'm hoping, going to break down some of the silos in our health and social services in the territory. But if we want to see those new models of care evolve and change, and we want them to better serve the needs of Yukoners, all of your voices are going to need to be there, guiding the way and helping inform what that future looks like. But that change is in front of us right now. So I really can't imagine a better time for something like SPOR to be taking place, for all of you in this room to be reflecting on health, the healthcare system, what you want to see, and to be able to unify your experiences and voices so those things can be brought into the system as it evolves. I think that really will give us an opportunity to do something really unique. One of the amazing things about the Yukon, I think, is just our size. Because it's a small territory, it means that we can actually have significant change at scale much easier than bigger places because we all know each other. We can identify all the stakeholders. Everyone's voice can be at the table. So I think our ability to really reimagine something different is realistic. If you look at a place like Ontario, yeah, that's going to be a lot harder. But I think in our context, why can't we do that? And I think all of you will provide that inspiration that we need to really take on some of these challenges as we move forward. As you head into those next 2 days together, I hope that you'll reflect on what the health priorities should be for the Yukon, what it's going to take to guide the work, and ultimately emerge with a vision of what our community needs SPOR to be and how it can really move the dial on some of these critical issues. I'm going to not take too much more time since we had those technical issues. I don't want to mess up your schedule, but I really do feel that this is an incredible opportunity for collaboration, for vision, for breaking down silos, for moving away from the status quo, and to really start at looking at how health can be nurtured and created in our communities. I'm happy to take any questions if anyone has any questions, but I'm really excited to connect back at the end of this weekend that you're all having together the next 2 days and hearing what came of it. And I'm looking forward to the opportunity to work with all of you as we move forward with these really critical issues. So thank you everyone for being there today and for your excitement over this project. I think it's a really exciting moment for the Yukon.
Thank you, Dr. Smart. Big round of applause for you here in this room, and I'm sure virtually. And I just have to say, you're a whiz with your phone. I'd be jiggling all over the place, but you look very, very stable, so that's great. We're going to take questions. Good. We're going to take, we have a time for a question or two. So if you have a question or a comment for Dr. Smart, there is a microphone in the middle of the room. You can come over here and visit these nice ladies at this table. If you have a question or comment in the chat, feel free to put that in there. But we'll leave the floor open for anybody who has a comment for Dr. Smart or a question for her keynote. Anybody? Anything online? Good? Everybody's good? Some powerful message there. Dr. Smart, appreciate your time. I understand you have a flight to catch later today. So we really appreciate you coming in and spending some time and your inspirational messages about the changes that are needed in our system and the role that every Yukoner can play by raising their voice to make sure that happens. So Gunesh Chish, thank you very much for joining us. Maybe another round of applause for Dr. Smart.
Thanks everyone, and good luck with your meeting. I hope it goes really well.
Take care, travel safe.